Hi, I'm Dr.Triveni Arun. I have done MD MRCOG from UK in obstetrics and gynecology. I have an experience of 16 years in obstetrics and gynecology. Presently, I am associated with Cloudnine, Sahakarnagar, Bangalore. Tests done in the second and third trimester include blood test and the scans. Coming to the blood test, the common blood test which is routinely done is between 24 to 28 weeks, where we do the complete blood count, the sugar test, the glucose challenge test, the urine routine tests. And if a woman is on any thyroid medication, we will have to check for the thyroid test. So coming to the complete blood count, the hemoglobin will be checked to look for the levels whether they are maintaining or they are dropping. In case they are dropping, then we'll have to advise the woman on dietary iron intake and to take the iron supplements regularly. And coming to the sugar test, this will give us an idea about whether the woman is having any chance of developing high blood sugars in pregnancy, what we call as gestational diabetes, and helps us to monitor further. And in the urine test, we will get to know whether a woman is having any infection which we need to treat. And if a woman is having any medical conditions, like for example, if she is known to have high blood pressure prior to the pregnancy, then we will have to check out for her organ functions, like we'll have to do a liver function test and her kidney function test, and also we will have to keep a close watch on her blood sugars. And coming to the scans in the late pregnancy, that is in second and third trimesters, routinely we will have to do a growth scan, which will usually be done at around 30-32 weeks of pregnancy, which will give us an idea about the growth of the baby, the blood flow to the baby and the water around the baby. And also in case of any low-lying placenta which has been diagnosed in the 5th month of pregnancy, the growth scan would help us to check whether the placenta is still low-lying or it is moved up, and to guide her further. And during the growth scans, if we feel that the baby is growing smaller, then we can advise the woman on the dietary intake, especially on the protein intake, and keep a further follow-up to check on the growth of the baby. So the follow-up scan would be at an interval of at least 3 weeks to see the growth of the baby.